Syphilis is a disease that progresses through distinct stages if left untreated: primary, secondary, latent, tertiary. Each stage has its own set of signs and symptoms, which is why understanding this timeline is so important. The first stage is primary syphilis. This stage typically begins about 3 weeks after exposure, though it can range from 10 to 90 days. The hallmark sign is the appearance of one or more sores, known as chancres. The chancre is usually firm, round, and painless. Appears where the bacteria entered the body. Because it doesn't hurt, it can easily go unnoticed, especially if it's inside the body. The chancre will heal on its own in 3 to 6 weeks, but the infection remains, and can progress without treatment. Next comes secondary syphilis. It starts as the chancre is healing or weeks after it disappears. The infection becomes systemic. It spreads throughout the body. Symptoms are more noticeable and can include a non-itchy rash on the palms of the hands and soles of the feet. After secondary symptoms fade, the infection moves into the latent stage. Latent means hidden. If untreated, 15–30% of people progress to tertiary syphilis. This can occur 10–30 years after the initial infection. Tertiary syphilis can be fatal. The bacteria can severely damage internal organs including the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. When people experience muscle pain or myalgia during the secondary stage of syphilis, they often describe it in a very particular way. It's not usually the sharp, localized pain you'd get from an injury, like a pulled muscle from lifting something heavy. Instead, it's typically a more generalized, dull, persistent ache. Many patients say it feels very similar to the body aches associated with a bad case of the flu. The pain can be widespread, affecting large muscle groups, arms, legs, back. It might be accompanied by a feeling of heaviness or weakness in the limbs, making everyday activities feel more strenuous than usual. This is a direct result of the body-wide inflammation triggered by your immune system. The intensity of the muscle pain can vary significantly from one person to another. For some, it might be a mild, nagging soreness. For others, the aches can be much more severe, becoming debilitating, interfering with sleep or daily tasks. In the rarer cases of syphilitic myositis, where the bacteria invade the muscle tissue, the pain feels different. It tends to be more localized and intense,